Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about constipation in your baby. When a baby is constipated, she has difficulty having bowel movements. Constipation occurs more often in older infants when a baby begins eating solids or with other dietary changes, but it can occur in younger babies too. We once believed breastfed babies didn't experience constipation because breast milk contains a natural laxative. However, we now know that while constipation is uncommon in breastfed babies, it does happen. If baby is breastfeeding and goes a few days between bowel movements, it's not constipation if feces are soft. The main symptom of constipation is baby's difficulty passing dry, hard stools. She may also have abdominal pain, which decreases after a large bowel movement. Baby may go several days between bowel movements, and you may notice stool is blood-streaked. Constipation can also cause a stomach ache. Straining may be another sign of constipation. When baby is straining, her face will often become red and she may cry, grunt, or make other noises. When baby starts eating solids, she may become constipated. If this happens, increase her fiber intake and give her more fluid. Feed her baby cereal with added fiber and try some mashed vegetables such as peas, beans, or broccoli. You can also try giving her a teaspoon of Caro syrup in 4 ounces of water. Most cases resolve with time if they're caused by a change in diet. There are some things you can try to help relieve baby's constipation. First, make sure baby is getting enough fluid. Fluid helps relieve constipation. Massage may also help baby. Give her a warm bath to help relax muscles. Then lay baby on her back and gently move her legs in a bicycle motion. Next, massage baby's tummy in a clockwise direction with firm, gentle circular motions from the belly button out. Foot massages may also help relieve baby's discomfort. Gently rub the center of the soles of her foot to provide relief. Call your pediatrician if the above measures don't work. Do not use any medication to relieve constipation without first calling your doctor. Call immediately if your newborn baby under 6 weeks old is not pooping at all. Call the office if baby's constipation is accompanied by severe abdominal pain or vomiting, she experiences any bleeding, or if she also has a fever. And if baby isn't gaining weight or is losing weight, let your doctor know. Your doctor may suggest an enema or a mild laxative for baby. If constipation becomes chronic or serious, testing may be ordered to determine the cause. There are a few more serious problems a baby may experience that are associated with constipation. Irritable bowel syndrome, IBS, can affect children with bloating, abdominal pain, alternating episodes of diarrhea and constipation, and stool changes. The cause may be genetic. Unfortunately, medication is not usually very effective, so a child must avoid trigger foods. Eating meals on a regular schedule and getting enough sleep may also help. Discuss this situation with baby's doctor if you have a family history of IBS. Hirschsprung disease occurs when nerve cells in the colon don't form completely and stool stays in the large intestine. The problem can affect newborns, babies, and toddlers. The problem usually starts at birth, although symptoms may appear months or years later. Your doctor will advise you if he or she believes this may be a problem for your baby. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format, and each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.